Hello, I'm Dr. Samantha. I am the founder and practitioner of Walk the Natural Path, Hormone Health and Fertility Care, and today we are going to talk about male testing for fertility. All right, so welcome back to my channel. Here we talk about all things hormone health and fertility care. Today's topic is about male testing. So the reason why I'm actually making a video about male testing first is, one, I don't think it's talked about enough. Two, it's so much easier to test males than females. But anyway, let's get to it. So male fertility, like I said, something that's not talked about as much. I feel like a lot of times a semen analysis is done and then everything's good, we're done. I don't agree with that. So semen analysis, one, super easy to do for men. Yes, it might be a little uncomfortable. Sometimes you have to go in and, in the doctor's office. So not men's favorite thing. However, they're also at-home tests. I'll actually link one of my favorites down below. I don't make any commission by having this link, but if you do click on it, you do get 15% off, which is really nice. It's called Legacy. They do regular semen analysis, but what's also cool is they do DNA fragmentation tests. I really like this because along with checking how much sperm you have, the shape of the sperm, how the sperm swims, so if it's like forward, backward, sideways, it tests for that, but it also is testing for the DNA. So what is the quality of the DNA in the sperm? Which does matter greatly. Finding DNA fragmentation in sperm is going to be so important, or I should say the percentage of it, because if we're having over a certain percentage of DNA fragmentation in the sperm, we need to treat, we need to reduce inflammation, we need to better environmental toxins, because if we're having a higher percentage of that DNA being fragmented, essentially, we're at higher risk for miscarriage. It's harder to conceive in general, and maybe embryo's not as healthy. So DNA fragmentation matters a lot for many different things. So I just always say, if you can, you should check it. Like, why not? Especially though, if you do have history of loss or miscarriage. So that is something I highly recommend. So first test, semen analysis. That's the one I think pretty much everyone knows across the board. I personally recommend couples going to get that done first because it's just, like I said, easier to do, not as invasive. I mean, I guess it's invasive in some ways. There are at-home options, so maybe it's not as invasive as it once used to be. We'll talk about the female ones on my next video next week, but their testing is a lot more invasive. We have the stirrups and everything, so like I said, it's just easier to do a semen analysis first. Next testing would be blood tests or serum labs. I always like to pull testosterone. Total and free testosterone. Estradiol, also important. FSH, LH, obviously those don't need to be on a specific day for men. They don't have a cycle, but those are still gonna be important to pull. I like a regular CBC, looking at red blood cells, white blood cells, different categories of different white blood cells. That can just be important for just general health screening, as well as a CMP, a comprehensive metabolic panel, which looks at kidney levels, glucose, and liver enzymes. In addition to those, I really like to pull things like ferritin and insulin. I also like to pull sex hormone binding globulin, DHEA, sulfate. I also like to pull things like CRP and homocysteine. Those are inflammatory markers, so that can tell us a lot about what's going on in the system. Those are the basic hormone labs that I like to address, right? So after that, it's really going to depend on the specific case, the specific individual. Their signs and symptoms are going to make a difference. Do they have acne? Do they have anxiety? Do they have hair loss? Do they have bloating? Do they have joint pain? Honestly, the list can go on and on. Are they fatigued? I could probably sit here and list off like 100 symptoms, but at the end of the day, the serum labs that we do are going to depend also on symptoms. But the first ones that I listed are a pretty good start. After that, I do like to throw out a gut test. I used to just do those a little bit more sparingly, but the more I do them on fertility patients, the better results I see with just people conceiving naturally, or, IUI or IVF didn't work before and then now all of a sudden it works again. So now I'm kind of pushing those more than I used to, just because I like to see what's going on in the gut. Most people have some kind of issue with the gut that needs rebalancing, and it's just it's something that's nice to do. That is a stool test, so you get to know yourself on a whole new level, that's for sure. But ultimately, it can give us a lot of information like types of bacteria, viruses, parasites, candida, so fungus, and then how you're opportunistic, so bacteria that are always kind of within us, but not ones that we necessarily want to overgrow. And then our commensal bacteria, where is that? Commensal bacteria, believe it or not, can be obviously too low, but it can also be too high. So we don't want too much of a good thing. Kind of like with everything, right? Other tests you can get done, reproductive microbiome is really important. Again, I think gut health plays a role in that, but other tests you can do are specific reproductive microbiome tests. One of my favorite places is actually Fertility. Again, I don't make money from recommending them. I'll put their link also down below in the description so you can get to their testing. They're a company based out of Greece, and I feel like they have a lot of really good tests available for people just kind of searching for that extra thing that might be going on. Again, those are kind of the tests that I'm like, we can get to those later once we fix everything else that's more prominent or the more likely cause, right? Like those, making sure all of those labs that I mentioned before are actually all good and with optimal range before we move on to the more complex testing. So again, Fertility is a really good brand. They test the microbiome, make sure there's no urea plasma or anything like that. Another test that I really like is Antisperm Antibodies. The male can have them and the female can have them. This is a test where I used to get done through another lab, but I haven't been able to find that lab in a while. I do think that there are companies out there trying to develop one or perfect one. So that is something to look out for. Honestly, if anyone knows about the Antisperm Antibody test, and if they have a new good one that they know of, please comment here. I am sure that the tests I just named were almost a little mind-blowing because a lot of people don't understand how much the male side of the couple can be treated and evaluated for fertility. A lot of people just say semen analysis and testosterone and just leave it at that. There is so much more that you can do and test your male partner for. Look out for signs and symptoms. If your male partner doesn't feel 100% optimal, that's usually a sign that something else is going on. There's an underlying cause. However, I do see male partners all the time that actually feel fine, feel great, but their semen analysis was not optimal, and we work on a lot of things. We check their gut health, we check their thyroid. That is something that I forgot to talk about before. So real quick, the thyroid, I like to test TSH, free T3, free T4, thyroid antibodies, so TPO antibodies, anti-thyroid globulin antibodies, and then even reverse T3 sometimes. Anyway, back to what I was kind of saying. There's so much more that can be done and tested for the males, and we want to rule out to make sure that those things aren't impacting fertility. And I feel like a lot of times people just do a semen analysis and say, oh, everything's good on the male side. Sometimes their testosterone isn't even tested if their semen analysis looks normal. I just threw out the air quotes there because optimal is different from normal. I will also link a free semen analysis evaluation guide down below. It goes through what a semen analysis is and it tells you optimal versus normal values. So if your partner is not within those optimal values, I highly suggest that you find someone to work with you so you can get them to those optimal values. Anyway, as always, thank you so much for being here. This one's also kind of short and sweet this week. Remember, we come out with a new video every single Friday. Next week is going to be about female testing, and please give this video a thumbs up if you enjoyed it and learned something new. I hope you have a beautiful rest of your day.